Hello and welcome to exam practice screencast. The key focus then of today's exam practice is going to be altitude. So if we start off then, just get this concept of an exam practice screencast. You are going to get a question. At that point, you pause it. If you feel like you can answer the question after pausing it, great, crack on. If you do not feel like you can answer it, the next stage will be for you to kind of move on to let it play a little bit, and there'll be a trigger slide that will help you. And then following that, you have a go at answering that, and then you will check it. Slide 3 will be the answer. So that'll be the process behind the two questions we're going to focus on with altitude. So the key thing on altitude, then we've got to split it really. Altitude is there's two key things. We have to look at the initial impact of altitude on performance, or gaseous exchange on the respiratory system or cardiovascular respiratory systems. It's going to have a real negative effect on these two, and we have to understand the processes that lead to that. On top of that, we have to look at the process after, at a period of acclimatization. So if you acclimatize to altitude, there is then the possibility of a positive effect, but we need to have an understanding on the timing of arrival of altitudes above 2,400 meters. So that'll be our key focus on question 2. So if we go through them, first up, let's have a look at the question. Explain the initial effects of high altitude exposure on performance. Now, it might say here the respiratory system. It might say here on the cardiovascular or cardiorespiratory system. At that point, I think here you'd be talking about 4 marks. The next bit might ask you about performance in aerobic and anaerobic, the impact on the aerobic and anaerobic events. So you'd have 2 marks, one for aerobic, one for anaerobic. So your question will be split 4 and 2. I will ask you now to see if you can have a go at that. If you can't, let's move on to your trigger slides. So the trigger slide then is this concept here. So we're looking at the concept. If you look here, could you look at that word hypoxic? Do you know what it means in relation to altitude? Okay, what does it mean? Then we have to go through the process of respiratory or gaseous exchange and how it is inhibited by the concept of hypoxia or hypoxic conditions. So here, little things here, little triggers. So these are thinking questions. What gas are we concerned with? Well, oxygen, because we're looking at kind of how that works in aerobic events or particularly in altitude. Then we're looking at areas of alveoli to blood to muscles. Then we're looking at this concept of kind of gases moving from high pressure, low pressure. This bit is inhibited, okay, because of the whole process down here. So first up, you're asking yourself this: what happens? You've got to put all these things into context, and they all have a negative context. So partial pressure of oxygen, what happens to it? It's reduced. This means a reduced this. This means reduced this. This means there's a reduced association between oxygen and the thing in the blood. This reduces the oxygen diffusion gradient between the blood and the muscles. This then has a negative effect on the actual oxygen going into the muscles, and then this has effects. Okay, so there are effects on this. There's an increase of 2 things massively when you're at altitude. You can't get your breath. I'm not going to go through that too much more, but there's also a decrease. And then from here, aerobic performance, there is an impact. Is it positive or negative on aerobic performance? I think you should be able to work that out. And anaerobic performance then, activities without the requirement for oxygen. What's going to happen to performance in that? As this whole topic is about the reduced oxygen partial pressure in the air. So hypoxic then, what is it? Conditions at altitude are kind of termed hypoxic. This means there's a reduced partial pressure of oxygen in the atmospheric air. Now, this can have effects initially. I might just think of this concept here. If you ever go at altitude, because of this, you are gasping for air, and you're gasping like crazy. So what happens is 2 things straight away go up. You have an increase in breathing frequency, and you also have an increase in heart rate, because if you can't breathe, you're trying your hardest to get your breaths. So there's a massive increase in breathing frequency, the amount of times you breathe, and this then directly impacts an increase in heart rate. You don't have to put this here. You might decide to put it down here, but it's up to you. You have to have it somewhere. Now, let's go into the gaseous exchange process then. There's a reduced partial pressure of oxygen in the alveoli because of there being a reduced PO2 in the atmospheric air. This then, of course, reduces the diffusion gradient between the alveoli and the blood. So this means that then, of course, as a result of that, there's a reduced oxygen diffused into the blood, which means the next effect is a reduced association between oxygen and hemoglobin. There's a lower levels than there would be at gaseous exchange at sea level. Then you're going down to here. This then, of course, impacts the diffusion gradient between the blood and the muscles. Okay, and this then means you get less oxygen diffused into the muscles. Now, obviously, this initial effect of altitude has massive effects. As I said earlier, there's an increased breathing frequency, an increase in heart rate. Why? Okay, so if we have a look at this, go down to here, there's an increase of breathing frequency, minute ventilation. So there's a decrease in blood volume, there's a decrease in stroke volume, there's a decrease in cardiac output. All these things are inhibited by the fact there's a reduced oxygen into the blood. So we're struggling to get the blood ejected to the muscles per beat. We're struggling to get the blood ejected, oxygenated blood ejected to the muscles per minute. Now, because of these two things decreasing, your heart rate has to increase to maintain cardiac output. It has to work even harder. So you're getting this, you're trying to get as much air into your oxygen into your working muscles because there's less of it, so that increases your breathing, but also there's an increase in heart rate to kind of compensate for these two things going down. Now, what impact does this have on aerobic performance? Well, obviously, if we're having this situation where you have a reduced oxygen starting off in the atmospheric air and then moving down the gaseous exchange cycle, then we have a problem. Okay, so aerobic performance will decrease. This will lead to a reduced intensity and duration of exercise before you reach that point at which lactate accumulation exceeds the speed at which you can remove it, which is obla. Okay, so that is a problem. It reduces your VO2 max, particularly poor initially with marathon runners or aerobic performers will find it very difficult to perform at their maximum. On the other hand, on the flip side to that, because anaerobic performers do not require oxygen to work, this could have quite a positive effect on them, because the air, you can't really use this in the exam, but because of the reduced PO2 in the atmospheric air, there's a reduced air resistance. Now, this can have massive impacts on explosive maximal sports, such as sprinting, throwing, jumping activities, because of the reduced air around the object. This means that you can kind of be more streamlined and actually perform better. Okay, so it has limited, and of course, the other side is you do not require oxygen to break down fuels such as kind of glycogen. You could do it without. All right, so they will be your key things there. That's why that performance, again, PC, not required oxygen, so therefore it doesn't inhibit it at all. So that's your first question then. That's our initial impact of altitude on performance. However, people would not do it. People would not train at altitude if there weren't some positive effects. So the positive effects then only happen after a period of acclimatization. So next question is looking at the process, or this one here, explain the process of acclimatization at an altitude of above 2,400 meters. Now that's important here. So we need to know what this is. We need to know why altitude needs a period of this, and then we need to have an understanding of the time period for this section. 3 benefits then, if people do acclimatise for the appropriate period before an event, what are the benefits? What can happen? Why do people do it? So, first section then, I've got to talk you through about that. We have to know what is acclimatisation. That's your first bit. Now, there's a reason. So what effect does altitude have on performance or ability to utilise oxygen that requires a period of acclimatisation? And that's a key thing for you to start to think about now. If we're saying acclimatisation, A equals A, so adapting to new environment, what is it about this? What do we say was the initial problem? What's the whole start point that altitude causes problems for with regard to the utilisation of oxygen or the diffusion of oxygen? And then, do we know the time period that is required when at 2,400 meters or above for altitude? Do we know how long it's required? And then once that happens, do we know the benefits? Increased production of, then we're looking there. So then do we know what what 2 things are stabilized, and then do we know what things are decreased? So increased, stabilized, decreased. They'd be our key things through there. Let's have a look then. So, firstly, what is acclimatization? So it's a process where an athlete gradually adapts to a change in their environment. So then we need to say, what is the change in their environment linked to altitude? The lower partial pressure of oxygen in the atmospheric air. So the reduction in PO2 in atmospheric air at altitudes of above 2,400 meters. And then we need to know the time period that's required to acclimatise when you're at a meter gradient that's above 2,400. So what you need then, you need a 2-week acclimatization period for 2,400. It'd be 3 to 5 days if it was kind of 1,000 to 1,500. But this period here is the specification. This is what it's asking about. So you've got to know 2 weeks. 2 weeks is the magic number really for you, because they can't be talking about things lower than that because that's what's in the specification. Okay, so that's your first thing there. So hopefully you feel like those 3 points, you're able to answer that pretty well. Now, if I move on from there, you're now looking at your next section, which is going to be the benefits. So if you have a prolonged period at kind of altitude, what things start to happen? Well, you have an increased production of a natural hormone, which then increases the kind of production of kind of something that helps us carry oxygen to the working muscles. See if you can remember that. Stabilize. The two things that were high when we got to altitude then become stabilized. They're still higher than sea level, but they're stabilized. And then there's certain things that are decreased. Can we start to think about what that might be? First thing then, so there's a natural release, of the hormone erythropoietin, okay, which is, we've talked about in ergogenic age, recombinant EPO, okay, so this then, don't have to know all this stuff really, all the bits that are in red are important. This will increase red blood cell production. This means that you get an increase in oxygenated blood to the working muscles. What's stabilized after a period of acclimatization then? Well, breathing rate and ventilation. So basically those two things will kind of will start to stabilize. They're not going to be as high as they were, but they are higher than exercise when compared to sea level. Okay, finally there will be a decrease in altitude sickness, headaches, breathlessness, poor sleep and lack of appetite. So these things that people get when they first go to altitude, these then there starts to be a reduction in this. Okay, so that is your altitude section. I would certainly suggest now that you have a good go at thinking about kind of how you would answer those questions. Do you feel confident if you had to go through those again? So you've had a look at those for now. If I went back onto here, you might just give yourself a go now. So if I said at this point now, pause it, have a go. Do you feel you could answer that again? Or if I went back to here, do you feel like you could have a go at this? Let's look at the difference between them. Back to the specification, you've got these key bits here. So these are the things kind of you'll be asked about. They'll be linking to these. And then obviously just make sure you can tick off the bullet pointed areas. Okay, thanks very much.